gotta tell you, when parents come in and they see like, hey, my child has anxiety, they had developmental delays, and the child's 3 years old, and they're sick all the time. They're getting chronic ear infections all the time, and they had reflux as a child. They had colicky as a child, and we're worried because they're starting to develop tendencies that they're not bonding okay. And I gotta tell you, when I start to hear these and understand these, I'm thinking one common problem with this, and that is the vagus nerve. And we are going to geek out on the vagus nerve today because it explains so many childhood conditions that it is worth our attention, and it's going to help you understand as the parent what's going on with your child. And it's very common. I see this all the time in my clinic, in my practice, that these problems will start to show up. And oftentimes it is the vagus nerve that comes right up from underneath the skull, travels down through the neck, yours too, and comes right up here and settles in the gut. It controls the upper 2/3 of your digestive system, your child's digestive system, a big patch right here, the heart, the lungs, immune system, bonding, right? Swallowing, even the voice of a child, sensory, and all those types of things. It explains so much, and we're going to dive deep into this. So where you're going to notice that problems come to the vagus nerve can come from birth trauma, and I covered this in my last video. So if you need to understand, if you suspect, hey, you know, maybe my child had some issues with birth, definitely go back and watch that video. But this video is going to talk about the vagus nerve specifically. Now, the vagus nerve, I already talked about where it comes from, but think of it as the rest and digest nerve. It is like the gas pedal for your body. It's going to calm the body down. It is going to allow your body to digest food. It's going to has a soothing effect. And so if we don't have the vagus nerve working properly, well, the body's all out of control. It's like driving a Lamborghini with Ford Pinto brakes. It just doesn't happen very well, and they don't mesh very well. So what are some things that we start to see with the vagus nerve? Well, first of all, it gives motor attention. It tells the stomach to digest food. It tells the lungs to breathe. It tells the heart to slow the heart rate down. Okay, it has a little nerve that loops around up here. It comes back up to the voice. It controls part of your voice too. So problems with these vagus nerves can also cause like a hoarse voice or a raspy voice as well. Problems with swallowing, those types of things. So it's also motor, but it also senses things as well. It also senses like, hey, what's the environment like? What's in my stomach? Am I bonding okay? Can I make eye contact? So it's a lot of sensory social cues as well that definitely feed this part of the brain. It's the right side of the brain, which is the bonding brain, where we get our understanding of we need to be social. We need to depend on mom. We need to depend on dad. We need to know what love is. So it's that type of oxytocin and vagal nerve, the bonding part of your body, that's really important. So let's talk about some things that can start to happen. We're going to divide it into 3 categories. First, the physical problems, the mental issues, and then the chronic developmental issues as well that can arise with poor vagus nerve function. So first of all, physical problems, digestion, not able to sleep, calming down, heart regulation, respiratory issues. Those are some physical problems. In fact, digestion and immune system go hand in hand because 80% of the immune system is in the gut. So if this nerve isn't working correctly, it causes this gut to be grumpy. And think of it like a nervous gut. If you ever had to go out and sing in the 5th grade, you didn't feel like eating a peanut butter and jelly sandwich at the time. Your nerve was tied in knots. You get anxious, right? So no, you've been through this before. I get nervous, I don't feel like eating. I get a queasy stomach. Why does I get a queasy stomach? Because the vagus nerve is over stimulated right now, and it's saying, hey, we're more worried about embarrassment or being called out than we are digesting food. So don't digest food right now. And we're getting a little anxious. It's a protective mechanism, and that has to do with the vagus nerve. Now, mental issues, anxiety, a child's worried all the time. Hey, the vagus nerve's not working, not pumping the brakes, so we're going to get anxiety. This goes on long enough, we start to get depression. effects of babies and toddlers where they're not bonding correctly. They get anxiety, meltdowns happen more frequently, and it's hard to regulate. They're in meltdown mode for 30 minutes, and it's hard to talk them off the ledge saying, hey, I understand, but they just don't get it, right? And then chronic developmental problems will lead to chronic problems through life. Some of these are very severe, like autism, ADHD, seizures, PANDAS, right? Where an infection can trigger the PANDAS, POTS disorder, anti-inflammatory and gut issues that can cause long-term effects as well. So what do we need to do to restore vagal nerve function? So I'm going to give you some things that you can do at home with your child and you yourself, because they're modeling you. They are watching you too. So if you're calm, you're going to help this too. So helpful hints that you can have at home. Then the one thing, hey, I've tried all these. We're going to talk about that at the end. But deep diaphragmatic breathing. Breath count in for 4. Blow out for 4. And do this with your child because they're going to watch you, okay? Deep breath in, blow out, especially before bedtime or after meals. It helps you to remember. It's the calming down. It triggers this nerve as well. Some skin-on-skin contact. Often this is called kangaroo care with your babies. And I know my little baby girl like snuggling up in my nest of chest hair, especially right here because it releases oxytocin. Oxytocin is the bonding hormone. It is like, hey, I know I'm safe when I bond here. But skin-on-skin contact is awesome. Dads do it too. Definitely right here, there's a patch, and then there's a patch that caulks the vagus nerve. It really releases oxytocin, helps baby calm down too. We call it kangaroo care. Nursing or breastfeeding is great. I like calling it nursing because there's a lot more that happens to just getting nourishment, babies bonding, moms bonding too. And I can tell you, my wife said at 2:00 in the night is some of her best memories with our daughter. Just nursing our daughter. Massage, acupressure, right? Little right here, this will help. Outer ear, just squeezing this, just helping you relax and stimulating the neck. Nice, smooth, relaxing touches. Back of the neck helps too. Back here will stimulate that too. Or even drawing on your child's arm and leg will help, just like, so you can tell when they're getting the goosebumps too. It helps calm down. Just light touches. Yoga and movement, okay? I will tell you firsthand, boys generally need a lot more movement. They need movement to relax, okay? Yoga is a good one too. Cosmic Kids, I recommend that. Daughter loves it. It's yoga for kids. The woman on there is phenomenal. She talks in a good Australian accent, but keeps the kids activated. My daughter loves doing the yoga there too. Get down and do it with your kids too. Remember, you're the role model, so they're going to follow you, what you do as well. Meditation, walk your kids through guided meditation. There's definitely CDs on this. You can download programs on this that will help do this. Do this in the car, right? When you're driving, put this in the car. Nice and easy stoplight. So they're in the car, they're not moving, they're in the car seat, and it's a good way for them to relax as well. Don't drive like a maniac when you're doing this, okay? What's going to happen if this doesn't work? Hey, we're still doing this, Dr. Andy, but my child is still not working correctly. Well, we know that, birth trauma is something that we need to course correct. So it could be a result of that. So get yourself, call up a neurologically pediatric chiropractor that's going to focus on the nervous system. They're going to measure HRV. Heart rate variability is an indicator of stress load in the nervous system, and it's measuring the function of the vagus nerve. And we know that if HRV is not really balanced and there's a lot of energy devoted to this, hey, we know that nervous system has a lot of stress load in it, and we need to know that that vagus nerve is compromised. That's allowing the body to calm down, allowing them to calm down. The sympathetic, if it's going to be, I'm going to get a little technical here. The vagus nerve has to do with more parasympathetics. Relaxing, digestion, getting your body to relax. Sympathetic speeds your body up. It's the Lamborghini, the gas pedal, okay? Parasympathetic is the brakes pedal. And they have to play nice with each other. If the foot's on the gas and the brake at the same time, the engine is just revving. If you're driving around and your foot's on the gas and you're dragging the brake, hey, you're just burning up the brakes. It's not working correctly. And if you just have, full throttle, no brakes, that's a recipe for disaster as well. We have to get these to play nice with each other and balance each other out as well. And if you have any questions at all about this vagus nerve, if this makes sense to you and you're saying, aha, this answers a lot of questions, please, let's have a chat. Let's have a chat to see what we can do to help you and your child live a much healthier, happier, much more fulfilled life as well. Hey, I'm Dr. Randy Wirtz in Thrive Chiropractic. If I can be of help, let me know. Make sure you're playing with your children. Do something nice with them. Make sure that you're role modeling as well. Take care. Bye-bye.